Hi Bursties, my name is Leigh Ann Montoni. I'm a registered dental hygienist and fellow Burst Ambassador. Today I'd like to talk to you a bit about CBD oil. What it is, what it isn't, and how it might help our patients in our own dental practices. CBD stands for cannabidiol. Cannabidiol is a type of phytocannabinoid found within the cannabis sativa plant. It is extracted from the stalks and leaves from the cannabis plant and used to produce the CBD oil or hemp oil. What makes CBD and hemp oil legal for use is it must meet the requirement that it contains 0.3% or less of THC. So THC is what is typically used in medical marijuana, and it has the hallucinogenic properties. So CBD oil is in no way medical marijuana, and it will not get you high, which is often what some people think about CBD oil. So like I said, it is a phytocannabinoid. The cannabis plant contains many phytocannabinoids, and they all have different properties and can help with different issues. Plant will also contain terpenes. Terpenes are it's what gives the plant their flavor or aroma, similar, say, to lavender. So together, the phytocannabinoids and the terpenes, they work together in a synergistic way to help our own endocannabinoid system. So we, people, have internally a system of receptors called an endocannabinoid system. And that system helps us with our sleep and brain function and immunity, and in general, it helps keep our body at a homeostasis, so at a level of health. Now, if that system gets a little off or it's missing in something, it can kind of throw everything off. So the way CBD oil works is when taken, it will bind with the receptors that are missing something. So kind of like a puzzle piece, it will bind with the receptors, and it will then allow your own endocannabinoid system to do what it does best. So that's how CBD oil works. The same oil might help one person with one issue, but also help somebody else with a different issue, being that it has brought back what that person's endocannabinoid system needed to allow it to bring the person back to a state of homeostasis. So the oil doesn't really do the work, it just fills in the gaps to allow your system to do what it's meant to do. So how could this be beneficial then for our dental patients? Well, many studies show that CBD can help out with various issues, and some of those are pain, inflammation, anxiety, depression, GI issues, things like that. So it is not uncommon for us to have patients who come into our office and they have high anxiety, they have acute or chronic pain, or even some inflammation. There are several ways to use CBD oil. The most common way and recommended way is to use the oil, tincture, or lozenges, because there are so many blood vessels within the mouth. It is a quicker uptake. Typically, an oil would be used in dropper form and a few drops placed below the tongue and held there for 30 seconds. It will take about 30 seconds to 2 minutes for that oil to reach our bloodstream. Once there, it can take about 30 to 60 minutes for the effect of the CBD oil to be noticed, and it can last anywhere from 6 to 8 hours. So an oil could be taken in the morning and then again in the evening should you need it. And some would do that, say for sleeping issues or anxiety, or again, pain or inflammation. Another way it can be used is topically, and that is more common for pain and inflammation. Topicals are going to be creams, salves, or even an oil, again, can be used. It would be rubbed on the skin. It can be used internally in the mouth or on the skin anywhere needed. That is going to only penetrate about an inch, so it's several layers of skin. It can only go so far, but it can be very effective at helping out acute or chronic inflammation or pain. There is not always a set dose per person because like I said before, it is going to work with your own endocannabinoid system. So what is always recommended is you start slow and low. If there is a dosage given, you start there and you give it a few days to a few weeks to determine if that's the right dose for you. If you're not feeling relief, then you can, and this pertains more to pain and inflammation, you can add a dose at a second time during the day, or add more drops or usage during just that one time of day. As far as anxiety, typically that is easier to dose out. So should someone have multiple appointments, it can be used with no issue, and it is also, it is not cumulative, so it can be used at very isolated times to help out when needed. Now, while it's generally regarded as safe, there are no reported side effects or dependency issues. It is always important to contact your physician prior to use to make sure that there are no contraindications with medications. Generally there is not, but for some medications it can cause them to work a little bit better or a little bit less than they normally would when CBD is taken with at the same time. Another thing to keep in mind is you always want to know your product. It is best to purchase a high quality oil from a reputable company. And the best way to do that is to research the company and make sure that they provide you with a COA. COA stands for Certificate of Analysis. That means this company, when they created their batch of oils, they had a third-party verifier test their oil. And they're going to test for all the various terpenes, all of the phytocannabinoids, so you'll know what's in it, because that might determine which oil you use, because some cannabinoids and some terpenes are going to help with anxiety more than sleep, more than inflammation, and things like that. What it also is going to check for, very importantly, is toxins. So you want to make sure that it is safely made through CO2 extraction, so there's no heavy byproduct and toxin exposure and heavy metals exposure in that oil as well. So always look for a COA when researching where to buy, purchase, and use your CBD oil. If you wouldn't mind, give us a thumbs up if you learned something new today, or we have sparked an interest and you want to learn a little bit more. I have found one book that was recommended to me and has helped me immensely in learning about CBD oil, and it is called CBD, A Patient's Guide to Medicinal Cannabis. Looks like this. This is a great way to start. It's very easy to understand, and I have learned a lot from this book. If you have any further questions, please write them below. We would be happy to try and answer them for you. Remember, you can always search the internet. PubMed is a great place to go. You will go to PubMed and type CBD and whatever issue or occurrence you're having, and it can help pull up some various articles about how CBD has been helpful with that issue. So again, give us a thumbs up or a heart. Let us know you learned something new, you enjoyed today's talk, and thanks so much. Bye-bye.